is estimated that 10 to 20% of patients who contract Lyme disease develop chronic symptoms. The exact reason for those chronic symptoms is not 100% understood. There certainly are theories and thoughts out there about why that could be, and there are even a few different terms or labels that would describe this particular condition. And I wanted to talk about those today. So the three particular labels I wanted to talk about: number one, post-treatment Lyme disease syndrome; number two, chronic Lyme; and number three, long haul Lyme, which basically borrows its name from long haul COVID. So what they've been seeing is that there is a lot of similarities in those cases. So let's talk about post-treatment Lyme disease syndrome. I think really the name kind of spells it out. Post-treatment meaning that someone who has contracted Lyme disease has received treatment for Lyme disease, yet continues to have symptoms. And the CDC acknowledges that this is a thing. They will say that, in their words, patients can sometimes have symptoms of pain, fatigue, or difficulty thinking that last for more than 6 months after they finish treatment. This condition is called post-treatment Lyme disease syndrome. Why some patients experience PTLDS is not known. And then they go into some of the different potential explanations as to why that is. Now, with post-treatment Lyme disease syndrome, one of the things that they really then hit home on is that we don't have any approved treatments for it at this point. And they're not wrong. It's just that we don't have a great understanding of exactly why people continue to have symptoms. So finding the exact treatment for something we're not sure what's going on, it can be quite difficult. But what gets me is this statement here. Towards the end of this, they say, patients with PTLDS usually get better over time, but it can take many months to feel completely well. But no link to any kind of reference or study that actually proves that. But yet then they go on to say how it can be quite harmful to continue treatment for some of these patients. And then they list several different studies that show where people had some issues after treatment for Lyme disease using things like ongoing antibiotics. So this is incredibly skewed, and I think does a great disservice to the medical community, and especially to the patients suffering with symptoms from Lyme disease. Basically telling them, we don't know why you have symptoms. There's really nothing you can do about it. And if you do try to do something about it, you're wrong and you're going to get hurt. And just give it time, it's going to get better. Tell that to the patients who have been dealing with this for years. When is it going to get better for them? So let's move on to definition number two, or label number two, chronic Lyme disease. Chronic Lyme disease infers that there is still active ongoing infection that is causing symptoms. And when we're also thinking about chronic Lyme, usually we're also thinking about the possibility of co-infections along with that, things like babesiosis, anaplasmosis, Bartonella. There's definitely other things that can be transmitted by these ticks, and they can certainly cause ongoing problems as well. I have seen positive cultures come back from patients who have had symptoms for many years after having a bite by a deer tick. So I know that there are still patients out there who are suffering from infection. To me, that's not a question. I believe and I have seen that patients continue to have ongoing infection. Now, the big question is we don't always know exactly why these ongoing infections affect certain people in certain ways. And the other thing we don't have a full understanding of is it just ongoing infection, or are there other factors? That's where I think the definition of long haul Lyme kind of comes into play. It kind of fits in the middle somewhere there. It acknowledges that a patient has contracted Lyme disease and yet they continue to have symptoms. And what it's looking to find out is why. So long haul Lyme to me is kind of that diagnosis that would indicate that we believe that there's something still going on. We don't know exactly what it is, but we're going to try to figure it out and we're going to try to treat that. So chronic infection is still on the table when it comes to long haul Lyme. That's still something that's being researched. as is autoimmune, inflammation, changes in the gut microbiome. All of those potential factors, plus others, can be issues that cause people to have ongoing symptoms. One of the biggest challenges lies in any patient with chronic Lyme is finding out and trying to figure out how much of the ongoing symptoms are coming from ongoing infection or some of those other things. It is my opinion, in my experience, that patients with ongoing symptoms from Lyme disease truly do have chronic Lyme and probably a form of long haul Lyme along with that. I think it's super important to make sure that infections have been addressed, and that by watching clinical progression, we can see if someone is responding to anti-infective treatment, which then helps to solidify the diagnosis of chronic Lyme. I have had patients as well, though, that have done better with more of an anti-inflammatory treatment. So there's definitely some issues there as well. I think it's really important to make sure that any patient that has chronic Lyme or chronic symptoms from Lyme disease, whatever you want to call it, that they're addressing all the possibilities, that we're leaving everything out on the table, and that we're not having a narrow-minded view of what can cause this. In my opinion, post-treatment Lyme disease syndrome lends us towards more of a closed-minded view, whereas long-haul Lyme and chronic Lyme are the way to go.